Hello there, it's glad to have you on another very interesting edition of Health Matters, a program where we discuss health issues just to ensure that you stay alive and you stay fit. I'm your host, Omo Basi. And we have in the studio a consultant radiologist and the immediate past president of the Medical Women Association of Nigeria, M1 Akwa Ibom State chapter, that's talking about Dr. Ekaite Mbat. Hello, Dr. Ekaite.
Thank you very much. Thank you for having me on this program. Thank you.
Thank you for coming. Okay, so today, what do we have on the front burner? We have breast cancer. I'm sure you've heard a lot about breast cancer. A lot of people live in ignorance. Some people have breast cancer and then they just refuse to accept it due to one reason or the other. And so Dr. Ekaite is just here to tell us more about breast cancer, how we can manage it, and I'm sure it's something that can be treated or prevented to help you stay alive for a longer period. Okay, so doctor, tell us about I think before you go into breast cancer, you tell us a brief about cancer and how you get into the breast and all of those things. Thank you.
Thank you very much. Okay, breast cancer. Basically, what is cancer? Cancer just means we all have cells in our body. When they begin to multiply abnormally and then they form tumors. When they grow out of proportion, you understand, then they just form tumors in the breast or any other organ, and then it may be malignant or it may be benign. So it's not all growth in your body that is cancer.
What do you mean when you say it's malignant or benign?
Malignant means it's cancer.
Okay.
Then benign means it's just a growth.
Okay.
It doesn't mean that it's cancerous.
Okay.
So what do we mean by the breast cancer? Breast cancer is that growth, abnormal growth in the breast that is malignant, that is cancerous. Okay.
And then breast cancer, talking about breast cancer, what are those symptoms? What are those things to look out for?
Okay, so first of all, we have to know the predisposing factors. Okay, the predisposing factors, we can actually divide them into the modifiable ones and the non-modifiable ones.
Okay.
The modifiable ones are the ones that you can modify, you can handle, like weight, you can handle weight. Eating a lot of junk food, you can handle that. Living a sedentary life, you can handle that. You have to be doing exercise, you understand? And then eating healthy, you can handle that. You can handle vegetables, more of healthy food than a lot of junk food. But the non-modifiable, you can't change it. You can't change the fact that you're a female with a much bigger breast than the males. I'm not saying that you can't find cancer in the male breast, but the percentage is very low. It's very low, you understand? So non-modifiable, you can't change the fact that you may have the genes that predisposes you or gives you a higher chance of having breast cancer. You can't change that one. You can't change the fact that some people, maybe the mother died of breast cancer, the grandmother died of maybe ovarian cancer. You can't change that fact. So those are why I'm saying modifiable and non-modifiable. Yes. Modifiable, you can modify. I don't want to take alcohol. I do not want to smoke again, because those are predisposing factors too. You understand? So these are the things. So when you know those factors, that you have a family history of breast cancer, you can't change it. So it's for you to be alert and know how to screen yourself on time. Some people go ahead to do like gene testing. There's something they call the BRCA1 and 2 genes, which if maybe the mother died of breast cancer and then you go do that and then you see that you have the BRCA1 and 2, you can decide to take off both breasts.
Even before the symptoms?
Yes.
Okay.
Like we have Angelina Jolie, you know.
Yeah.
She has a family history. The grandmother, the mother, I think the grandmother, either it was ovarian, the mother breast or so. And she, after having all her children, she now went to do this testing and found out that she had the BRCA1 and 2. She took off both breasts and her ovaries.
But how many Nigerians can afford
Exactly.
that?
It's not even how many Nigerians can afford that. How many Nigerians are willing to and are ready that, okay, they go, even though I think the BRCA1 and 2 testing is done in Nigeria. I can't specify the lab yet. However, it's expensive. But how many Nigerians that will go do it and they have the BRCA1 and 2 and they are ready to take off their both breasts?
That's true. That's a big question. How many Nigerians are willing to do it?
Yeah.
And you discover that some Nigerians come down with the symptoms, and they actually see that this is breast cancer. It's diagnosed that it is breast cancer, but they also think that it's something that could be managed with herbs. Is there any way around it?
Let's even mention some of the symptoms for them to know, for our viewers to know. You could have a lump in your breast, and you could have, you should know how your breast is naturally. You understand? One breast may be bigger than the other. You know how it is. You must examine your breast every month after your menses, maybe 5 days after your menses, not during your menses, because your breast will change during menses, and then you may be thinking, there's something in my breast, meanwhile there's nothing. So you must do it after 5-6 days after your menses, or 7 days. You understand? When your breast has returned to normal. You may find that if you used to have a pointed nipple, you may notice that the nipple may be inverted.
Okay.
If you used to have like your breast was just plain, nothing, you may see some rashes, you may see things like eczema on your breast, you may see things like abnormal, you may even see nipple discharge, like maybe bloody. You understand? So any abnormality you see in your breast, you must go to the hospital. For you to be able to notice this abnormality, you must know you're normal. So you yourself must know how to examine your breasts. You understand? So not only the breast, the armpits too.
Okay.
Yes, the armpits too, because some may just be in the armpit and the lymph nodes are there. Some may just start there.
Really?
And then you'll be thinking that it's just normal. It's just the breast. Do you understand? So when you're examining your breast, you examine your armpits too.
Wow.
And you try as much as possible, even if it's once in a year or 6 monthly, to go into a health facility. Like Medical Women, we have our own secretariat where we allow the women to walk in and their breast gets examined. Allow your breast to be examined by an expert at least twice in a year. At least, yes, while you do the other checks for yourself.
Okay. And then we also have this story about the breast sucking the breast. How does it help prevent breast cancer?
That's for the babies, not for the men. No. The breast milk, you understand, stimulates. Yes, it helps, but not the sucking, because I heard some men talk about not the sucking from the men. No. It's the breast milk from the child, from your baby. You understand? They say, allow your baby to suck your breast. You understand that it helps to prevent it. And remember again, I forgot to add that women that have never given birth, these are the nulliparous women. They have a higher chance of having breast cancer because no child has suckled the breast. You understand?
Okay, so you've heard it. If you're just joining us, the program is Health Matters, and we have Dr. Ekaiten Badere, a consultant radiologist, in the studio with us here, and we're talking about breast cancer. You've heard it. She just mentioned that when you're talking about sucking the breast, it's not about the men sucking the breast. Men sucking of breast does not help prevent breast cancer. We are talking about the babies here. And so Dr. Ekaiten is still going forward on breast cancer. A lot of myths around breast cancer, and I'm sure you've heard so many. Could you just tell us some of these myths that you've heard from women? Because our women, like seriously, we still have a long way to go.
I actually don't really like listening to it because most of them feel that it's witchcraft.
Yeah.
Most of them feel that it's witchcraft. But, well, maybe because I'm a doctor, I may not take it that way that it's witchcraft. I just feel that we should look at ourselves very well, check our breasts very well, know the normal. And then when you're up to the age of 40 years, you must do mammogram. That's x-ray of the breasts. Let us know you're normal. I'm a consultant radiologist, that's my area. Let us know you're normal. Because some may not come with breast lump.
Okay.
So when you do the x-ray of the breast, there are certain things that we'll see. We can see that maybe the architecture of your breast, architecture of the breast, because it has a particular way you will see it on the x-ray. If it's distorted and the consultant is feeling funny about it, they will have to follow you up. Do you understand? And there's something we call calcifications. They're like white dots on the x-rays. There are different types of calcifications. Some are big, amorphous, which are normal. Some could just be calcified anything in your breast. But there are certain ones that you see when they are of different shapes and sizes. Okay. Cluster together, or you see different sizes, different shapes, you know. Then it could tell the consultant that there may be something there. Do you understand? So people may pick that, and that may just be the beginning of that breast cancer that you've been waiting for a mass for you to palpate. You understand? Yeah. But the mammogram has shown it. So I would advise all women 40 years and above to do a baseline mammogram.
Okay.
Yeah.
And then how about the herb issues? Apart from witchcraft, some people just run to herbs. Herbalist drinking combination, some combined stuff to manage. At times
it even worsen. I had a friend. She had this breast cancer then. So when she had, I was talking to her. I was telling her how she could go about it. She should that was like it's up to 8 years though she passed, and she should go to the hospital, let them take off the breast and manage her properly. No, they told her that herbs could work, and they gave her things. She was rubbing on the breast. The more she was rubbing, the more the thing was expanding and expanding and became necrotic, and that was it, spread everywhere, and she finally died. So I feel that yes, I know it's difficult, do you understand, to accept it, that you actually have cancer, because we are human, but at the same time, let's treat in the hospital and still pray to God. So, because the Bible says faith without works is dead. You understand? Yeah. So we should work together and make this thing come to a reality that we live longer.
Exactly. I think I completely agree with you. Faith without works is dead. So while you're going to church, also try to allow the medical doctors to do their work. That's, you also present yourself in the hospital for some of those checks. You never can tell. It may not be cancer, or sometimes it could be something that just appear in the form of cancer, but it's something we could manage, and there's no need exposing yourself to so much risk. So Dr. Ekaite, before you leave, what's your final word to people out there? Remember, you said breast cancer could also affect the men.
Yeah.
So now when you're talking to the women and the men. Thank you.
The men too should also learn to examine their breast. Exactly. They shouldn't, even though they have the small breast tissue, it doesn't mean there can't be any cancer. And the men, most of the times, the men are even the ones that notice the lump in the wife's breast. You understand? So they're doing a lot of work on that. So kudos to the men that do that, you understand. So they help the wife and pick it up on time. Yeah. And my word again is that no woman should be afraid to visit the hospital, you understand, when you notice you have a lump. it may not even be cancer. It may just be a fibroadenoma, a benign thing, but you're just afraid that it may not be. But even if it is, if you go early detection saves life.
All right. Thank you so very much. Early detection saves life. I think that's what we are going home with today. Thanks for watching. It's been Health Matters with Umo Basedit. Bye bye.
Bukangin mi komo amiendi song kamando tumi giko bibi unkere utwe achipon mfanse ke soko kobodo soke tange maru abie bon bakara soko tangdo ye kamba manyeno mo pasidit e tange banga breast cancer jumbo do breast cancer mi isa angi mai tangsido cervical cancer mfane mi tange banga breast cancer nama iban na mi kani embo saya giso kita ibang cervical cancer lo giso ni ke fana iban anye mingo ni ke fana iban iwo ngoge kiden ki kemege ni cancer ke ba na be bon bakaro tang asoko tang abo kiden ni kemini ado ki waka ani ki fana iban ami nam abe bon bakara mi ro fre wuton iban te be baba ya si pini dim fo ka fo ibo yun ma kan na ro be nyo titi o fana ke ba nyo kan na bante iban fi ba na ke seba anyo bante mim faru go ngoni na afuni dem fo meri ngona ngidem fo siba ma do kiti anye bante ni na ho ba beni dem ba ka fo kansa mi ti mai kita tangira ba ado mention sium po se ki koriban gidem amari ko so bigo amari to ngopun ango me toro gwa anyiri ikapa mfana anami ban edo mudongo ndundun aseni ke fana ke wo wana do ino ko yene ba pa bet ibane mai man ndito yang dito e wo be ba mo ase mwa mo so pini cancer tange ba ami mention su so ba se ibane ke medini cancer mi uba do ke afome manare do bono do e kamfu ake pa ke cancer e ka kamfu ake pa ke cancer afori da su bonu fo ke cancer mi ama ngono ba ama bonori abe bon bakaro tanga bo ke ni mko e kemikere na mko fo ibo afoma so bo yo mko mi ma di ka fo ibo mi mbia bon makara e kemi na mko mi osogoro ke so mu abi benede mfo ka ofo ibo sa mo ri ongo nti item sebo no fin afo kemeke aribo konfana mi uba wo so mfene wo kemeke ni cancer mi ado mention ndio eruwe amme weruwo afo manari aido se peru dia afo dia me akemiro ba se ma ngwa mafoni eko ido mfane fo dia shawama mkpongo fo ta pizza ire mkpongo fo dia ice cream nkanga ndidia mo ba akpe dia kan te minkon membu ngo minwanga mi afre ko to fruit mi ado se wo pe dia ire mi so ngo nko ndindi ne fo ko fo ibox ya mfana ba ga mi ko cancer mi ido wo nam diso kitang mi anyo okene uba ge duwem ndio ye duwem nangi bana nyonge duwem da aforo boy kpam fini mi mana jen atime no ko yene ba e ba do ge do fon sumbo ngo ba se ge bore ba mi ba to ri ba no ndi to e ba awo ma bamba me nanga abe bomba kan ne do sokota enko abo me ebo ya mebe ide ne ke wo bi ba ne ba me ke mi wa ba ri ba ne ikuni cancer abe bon bakrari ne ke kido ne ke kitang ne ke ado se yetang aboke awunwan ama na yen ya gine mo wo be ba no yen fo re ba ne ke ami ke mi wa ma wunwan ri ke me ke so pini cancer akpa ni ba ni ne ke ni mpo ne ba man de si ne ke so e ke me ri so ni cancer so ke tang me aforo wo wunwan ma mi dim fo ama ro ebi ayummo mana yen no yen fi ba ken nin ni mbia bon bakara mi na mebo ya ke non to yin ba nko baba odo anyo ogwo be ba mi iro ntebo ke do bi nwam ya wo nwani kini cancer bele so ofo fon ari ya baba odo awo be ba mfo ntebo nwa busong fene yoro ama kan na ba fin gide memi ndi ki sokita tang ka ofo ibok sebo ke kansa mi anye ba ke ndara akpanda ba yonda ibaba yonda itaba tutun ake wonda se ke medi woro ado fo be so be ni de me ka ofo ibok eya ke pakke ba de si o ke pe kat ke kansa ke ro ini ere so do nam se pakke ba de so ya fo ka ba do wem afon yefo afon gugun fo akana fo rika mambodo nsanga patre wem fo ke boyo fe ke do soko aboyo akimima nte soko sanga ro kom na mo bia ke ba iro kansa iwo ngoke ke fre fanu bo so na mfin ke ba do kansa ake ne na ngado mpo ma na magogo kimi kumnyengidem imari ka ofo ke bo ke ke kansa ke ro suna na mfin benidem ka ofo bo ke ro bia bo mbakra bo ko do kofin ke mboro do kansa ubage do kansa iwo ngoke ke sefo baba do ke kansa ke ro ake minyondo eba mfun kan ke de se da akpono kan ke se iba na mi ni mfana nyom ka ke se na ngado ki wo ke suna na mado kansa ukanyin ibibio se nyini ke meru do kofine do ki ko ibibio ke banga ke fatse e kamba wo nyini ke so watanga do ye abe bo mbakara ke banga ke breast cancer ata panpo se nyini tang fune meru ma kom na mo ba ke dem nte wo wan ka ofo bo kunga ma ya bo no fin tamba to tinim fin ma tammi de